first important thing, please understand that both myself and yours. So our goal is that you should clear the entrance exam. So that is our goal. So, but please believe that the faculty who is teaching for past 10 years, 15 years or more than that, I am teaching for almost 15 years now. So there are many queries which students, they put their so much of the energy and which eventually we find that it is of no use. Okay, so you will eventually find out. Okay, so the important thing is that you should channelize your energy to the topics, to the points which are much more important, and just not give your maximum energy or your peak time, the best time of your day when you are fresh, to some weird questions with absolutely no language, options are not correct, and those questions are what 25 years back. Okay, so those questions are 25 years back. So please make sure for this thing. Okay, so coming to the first question. So what percentage of first molar show two distal canals? So I hope this question is clear to you people. So basically they are asking for first molar showing 4 canal pattern. The answer over here is 30%. I hope all of you know this thing. So 70% of the lower molar So 70% of the lower molars, lower first molars, so they will show 3 canal patterns. Means there will be a mesolingual, there will be a mesiobuccal, and there will be a big distal canal. But 30% of the lower molars, 30% of the lower first molars, they will show 2 canal patterns in the distal root. Means there will be a mesolingual canal, there will be a mesiobuccal canal, but there will be a distolingual as well as there will be a distobuccal. Okay, so if the canal is in center of the tooth, if the canal is big inside, if your file is going almost in the again center of the tooth, means usually there is one canal in the distal, while if the canal is present eccentric, means it is not in the center of the canal. If the canal lumen is fine, okay, say your 10 number K file is going into the canal, in the distal canal, and if the file is taking any curvature, means it is going either in buccal direction or it is going either in lingual direction, means there will be 2 canals. Okay, so remember how you can distinguish. Now over here you need to know about the type 2 wheels pattern also, which is common. Type 2 wheels pattern. So sometimes mesolingual and mesiobuccal may join and exit as a single apical foramen 2-1 pattern. Also sometimes this may be there in distobuccal and distolingual. Both may join and become a single apical. Okay, so type 2 wheels pattern you can see over here in this. If the canals are closer, means like this, so there are many chances that they will join somewhere during their course, during their, okay. So this is first question. तो अभी ना वी आर गोइंग टू डिस्कस, आई थिंक आप लोगों को कुछ हार्ड कॉपीज मिली होंगी, so we are going to discuss that paper only, okay. So we are going to discuss that paper only. हार्ड कॉपी जो आप लोगों को मिली है, we are going to discuss only that paper. So two canals are most often seen in maxillary canine, mandibular canine, maxillary lateral incisor. Answer should be D, mandibular first premolar. Over here, mandibular first premolar should be the answer over here. Look, in case of mandibular first premolar, many a time means type 4 pattern is very common. It means type 4 pattern. Type 4 pattern means it starts as one canal. It starts as one canal, then somewhere it divides and exits as two separate apical foramen. Two separate apical foramen. So this is very common. Okay. That's why mandibular first premolar, you all know it is known as enigma to endodont. So this is known as 1-2 pattern. 1-2 pattern means type 4 pattern. 1-2 pattern. Almost 23% chances. 23% chances of getting this means type 4 pattern. So there will be a big or a central buccal canal. So this is a buccal canal, and this main canal will give a lingual exit, a lingual branch, you can say a lingual exit. But now this is also an important canal. Okay, so this lingual, now to negotiate this lingual canal is very difficult. Okay, so many a time for this, so there are 23% chances of this 1-2 pattern. Okay, so 70% time it shows Wien's type 1 pattern. It shows Wien's type 1 pattern. But 23% time it shows Wien's type 4 pattern. Wien's type 4 pattern. Okay. Now negotiating this canal will be very challenging at times. So that's why over here, if you have access to direct operating microscope, it will be very beneficial, especially in tricky cases like this. If the canal is dividing somewhere beyond middle third, then it becomes very challenging without operating microscope to negotiate this lingual. Okay. So mandibular premolar, remember first premolar, the crown is tilted on the long axis by somewhere around, sometimes it is given 15 degrees, sometimes it is given up till 30 degrees. So 30 degree तक tilt हो सकता है, crown can be tilted on the long axis. So this bifurcation, this will be very faintly visible. It will be very faintly visible on radiograph. Very faintly visible. Sometimes so it is not distinguishable on radiograph. So this is already known as fast break appearance. Fast break appearance. जो points बता रहा हूँ, MCQs are there on each and every point. Okay, remember. I'm not going to mention कि इस पे भी MCQ आ चुका है, इस पे भी आ चुका है. All things are important whichever I am teaching over here at present. Okay? So, भाई देखो time is limited, so we cannot wander here and there. We are not your college teacher है ना, उनके पास ample amount of time होता है पढ़ाने का, बच्चों को भी नहीं पढ़ाते. So we have a very limited time. Whatever we are teaching over here is important for MCQ. Either MCQ आ चुका है या आएगा. Okay? So fast break appearance. Fast break appearance means if you see on the radiograph, the canal is thick up till the middle third, and after the middle third, you will see that on X-ray the canal suddenly disappears. Suddenly disappears. So remember, this is not calcification of the canal, but what is it? It is a fast break appearance. It is a fast break appearance. Means the canal is bifurcating into two smaller canals, or bifurcating into or trifurcating into three canals beyond this point. Since the canal is bifurcating or trifurcating beyond this point, so the lumen becomes very narrow, which is not visible on X. Remember, this image is not visible on X-ray, that the canal is bifurcating into. ये आपको X-ray पे नहीं दिखता. This is the third dimension which I am showing you. So this you can see on CBCT. Okay, so that is why it is called as enigma to endodontist, because according to a dentist or an endodontist, he has done a very good root canal. Why the patient is still having the pain? The patient is still having the pain because of the mid-lingual canal. Okay, clear? So the mandibular molars generally have, so this is a simple thing, they have generally two roots and three canals. Mesial root is there, distal root is there. Mesial root will have two canals, mesiolingual and mesiobuccal. Distal root will have a single distal canal. Okay? But remember, students, over here, I think this time only they have asked. Yes, this time only they have asked. So there was a question on radix entomolaris. Radix entomolaris. So if we see radix entomolaris, it will be like this. Okay. So there is a mesiolingual canal, there will be a mesiobuccal canal, there will be a big distal canal, and there will be a separate distolingual root. There will be a separate distolingual root. Separate distolingual root means there will be a separate distolingual canal. Okay. Along with that, at times there can be a middle mesial canal. Middle mesial canal which can be there. So they have shown you an X-ray. So they have shown you an X-ray image. So there is a distal canal which is obturated. There was a distolingual root over here obturated, and in mesial root there were three canals obturated. There were three canals obturated. So this is an example of radix entomolaris. This is radix entomolaris with middle mesial canal. Middle mesial canal. Okay. So this is middle mesial canal. Middle mesial canal is present between mesiolingual and mesiobuccal. Similarly, at times you may see a middle distal canal also. Middle distal canal, like middle mesial, so there can be a middle distal canal. Remember. Okay. So, but usually 70% times two roots, mesial root and distal root, and three canals. Distal root will contain one big distal canal. Okay. The fourth root canal if present in maxillary first molar is usually present in, I think simple है, आप लोगों को पता होगा, mesiobuccal root. Mesiobuccal root. So we are going to discuss the access cavity shape of maxillary first molar and mandibular first molar in a moment. Okay. So mesiobuccal 2, MB2, what we called it, so it is present in the mesiobuccal root. So mesiobuccal root, if we see the cross section, it is flat, concave, like this. If we see the cross section, can we keep it as a quiz? कौन सा quiz करना चाहते हो भाई? So this is mesiobuccal 1, and over here there will be mesiobuccal 2, which is present. So this is MB1 and this will be MB2. So remember students, over here there will be a palatal canal. So there will be a big palatal canal, and over here अगर हम cross section में देख रहे हैं, cross section में, so there will be a distal canal. So remember students, MB2 comparatively to MB1 will be mesiopalatal. Mesiopalatal. So MB2 in respect to MB1 will be, MB2 will be mesiopalatal. MB2 will be mesiopalatal in relation to MB1. Remember. ओके, मतलब आप लोगों ने सॉल्व नहीं किया है, ओके ठीक है, आई विल गिव यू 10 सेकेंड्स, है ना, बट सॉल्व करके आया करो भाई पेपर, है ना, बहुत इजी पेपर है, सॉल्व करके आया करो. तो चलो क्वेश्चन नंबर 5. सर्वाइकल क्रॉस सेक्शन ऑफ मैक्सिलरी फर्स्ट प्रीमोलर हैज, सर्वाइकल क्रॉस सेक्शन, so what will be the answer? Yes, good, elliptical shape. Now why not oval? Now why not oval? So look students, the answer is very weird kind of, but please pay attention. If we are talking about any mathematical terminology, then this is elliptical. Okay, this is elliptical. So elliptical वो mathematical पूरा terminology में आता है. While oval shape, so like egg is oval, like your egg is oval. So oval जो है वो mathematical terminology में not a very clear definition of oval. Okay, so maxillary first premolar, you are going to get a palatal canal and you are going to see a buccal canal, palatal as well as buccal. Remember, in maxillary first premolar, that sharp mesial concavity na is very important. That sharp mesial concavity is very important for NC. So because of that sharp mesial concavity, in operative dentistry or conservative dentistry, we are using wedging technique over here. Wedging technique came as MCQ. Then due to the sharp mesial concavity, there are chances of mesial perforation. The first chances of mesial perforation or distal perforation is high in mandibular incise. सबसे पहले तो चांसेस आर हाई इन मैंडिबुलर इंसाइजर. आफ्टर द मैंडिबुलर इंसाइजर, ना, if we remove the mandibular incisors, in which other tooth the chances of mesial perforation is high or proximal perforation is high, then maxillary first. What happens that the crown is so bulky, crown तो बहुत बड़ा है उसका, but the moment of crown से CEJ के just close आएंगे CEJ के, तो there will be sharp mesial concave, ditch आ जाता है mesial. Okay, आप लोगों ने carve किया होगा शायद maxillary first premolar, ना, wax carving में, तो you will be remember, you should remember this thing, that there is a sharp mesial concavity over there. So if we go access opening from that side, we may land up into mesial perforation. Okay, so remember this thing, important. Okay, so this is elliptical shape access opening. Elliptical shape access opening will be the answer. Two canals, two separate routes, a palatal route and a buccal route, and a palatal canal, single canal, and a buccal canal. So usually there are two routes, two canals. मतलब one canal. Which is least likely to have two routes? So yes, remember maxillary central incisor as well as maxillary canine, they are least likely to have a bifurcated. Okay, least likely to have bifurcated route. Simple to होते हैं, simple single canal. यहाँ पे sometimes we may mark the shape of the access opening as oval. Over here, you may mark the shape of the access opening as oval shape.